There we go. All right. Hello, everybody. Welcome. We're going to kind of keep admitting people as people join. So I just wanted to kind of start us off and give an introduction, thank a couple of people before we begin. My name is Christina Fadouk. I am one of the assistant directors and career coaches here in career and professional development at UNCG. I wanted to thank first Donna Myers, who me and her have kind of been collaborating a lot, starting over this past summer, actually, on a couple of different events, but this seems to be kind of the biggest event, like culminating event that we've kind of collaborated on. So I'm really excited that it's finally happening. Donna is the Administrative Support Associate in the Department of Public Health Education here. So thank you, Donna, for everything that you've done, especially getting that Governor Cooper video, which was really awesome. So thank you. The first thing that I'm just going to do to start us off is play a video that we actually did get directly from Governor Cooper. It's directed specifically at the Department of Public Health. So I will share that right now.
Hi, everybody. Governor Roy Cooper here. Welcome to this Department of Public Health Education career panel at the University of North Carolina at Greensboro. Today, you'll hear from panelists about their experience. The pandemic is shining a bright light on the importance of public health education. Your work helps people understand what good health practices look like so they can protect themselves and their loved ones. From developing and implementing public health programs to learning how we can best support our communities across the state, your dedication is helping us build a healthier, safer North Carolina for everyone. This past year has also highlighted the urgent need to expand healthcare access across our state. As governor, I'll continue to fight to expand Medicaid and close that healthcare coverage gap. I hope you learn about the many opportunities you can pursue with a public health education degree. Thanks so much.
All right. So that was awesome. If anybody wants that video too, I have it in just like an MP4 file, so feel free to email me if you want that. But so I just wanted to go over a couple of things first, and then I'll introduce our moderators for the day. So we will have a really good chunk of time at the end of this panel, about 30 minutes for students to ask questions. Anybody else who's joining, if you're not a student, if you're a staff, faculty member, there will be a good chunk of time at the end to ask questions. So as we go through, kind of write those down, collect your thoughts. If you do have something to ask, we will get to that at the end. But I wanted to introduce our moderators. So the first one is Professor Christina Young. She's an assistant professor and the director for undergraduate studies in the Department of Public Health Education. And she's also a proud alum. So she has 2 degrees from here as well, both a bachelor in public health education as well as an MPH degree from here. And then we also have Brittany Friday, who is a current senior in the Public Health Education Department, so graduating soon, which is awesome. Brittany is also a member of Eta Sigma Gamma, which is the National Honorary for Health Education. So welcome to our moderators. Thank you for our panelists for being here, and I will put it over to you. Thanks.
All right. Thank you, Christina. I'm glad to be here with you all this afternoon and to introduce our lovely panelists. I'm going to first introduce Wendy Renedo. She is the Senior Transcultural Healthcare Manager at Novant Health. And as part of the Department of Diversity, Equity, and Inclusion at Novant, her extensive background in 20 plus years of nursing and with the LGBTQ plus health disparities, she provides an inclusive environment for both patients and staff. And so we warmly welcome Wendy. And I'm going to pass it to Brittany to introduce our next panelist.
Good afternoon. Thank you all for joining today's panel. I have the pleasure of introducing Alex Espitia. Alex graduated from UNCG in 2017 with her bachelor's in public health education, with a focus on community health education. She oversees all public health, behavioral, health education efforts and programs. Everyone, I introduce you, Alex Espitia.
And last but not least, I'm going to introduce Chinwe Onyeagusi. She is a Customer Success Fellow at Manifest MedEx. Chinwe graduated from UNCG's Masters in Public Health Education program in 2021. Yeah. And has a bachelor's degree in health education and promotion from Southern Louisiana University. She is now working as a Customer Success Fellow at Manifest MedEx, a health information network working to get health information out of silos in California to ultimately reduce the costs as well as improve patient experience and outcomes. So we warmly welcome Chinwe as well. And now, Brittany, back to you.
All right, thank you for those wonderful introductions. So to begin the panel's discussion, we know that you do a lot within the public health community, and we know that you're very active within your role. So could you tell us about your current role and how did you get to where you are today?
I guess I'll go first. So, like I was just introduced, my name is Alex. I'm the Director of Community Education at Mental Health Greensboro. Just to give you a little bit of background information, we're a small nonprofit organization that offers free recovery-based services. And I always specify it's recovery-based in the fact that we don't provide clinical services to the community. What we offer are purely supplemental resources. And so I got to this position by having an internship here while I was in the actual program. And it just coincided that while I was doing my internship, the person in my position was actually planning to leave. And through my internship, I kind of proved myself to the executive director, and she took a really strong liking to me and like my work ethic and what I was doing for the community and for the organization. So there was like a two-way street for both of us where we were both benefiting, and she really appreciated that. So I kind of just got really lucky.
I can go next. So again, my name is Wendy Renedo. I'm a transcultural health manager with the Office of Diversity, Inclusion, and Equity at Novant Health. And so in my role, I do a lot with the LGBTQ plus community, as well as other underserved communities in the Charlotte, Winston, and Brunswick, New Hanover regions. And I do a lot of patient navigation. So patients that may have a special need coming in, such as for gender affirming surgery or things of that nature, where education is needed prior to their arrival to a healthcare setting. So I work with the patients in that way. Our office works very closely with the community in many different ways. My role specifically, I try to make sure that I'm a part of advisory councils and things of that nature so that we can always have a pulse on what's going on in our community. I am a nurse, and so how I got to my role is very interesting. I started as a bedside nurse in critical care many years ago, and sort of took several roles to get to this role, but always had a focus on diversity and inclusion. And at that time, equity was not really a buzzword, so to speak, but I knew it was something I was very interested in. And so I just kind of kept chasing that through my nursing career until I finally ended up being able to go into this role for Novant Health.
And I'm Onyeagusi. I'm the Customer Success Fellow at Manifest MedEx, and we're a health information exchange network. And so we help make sure that patient information gets to the hands of the providers, and that way it's getting there securely and on time. So that way you're saving money for costs, you're not duplicating efforts and things like that. My role is internally, I run the data analysis. So I help them with compiling the data and looking at the trends, providing recommendations, as well as evaluation efforts for the services that we provide. As far as how I got this job, it was a cold email that the recruiter sent to me on LinkedIn. And I looked at it, and the funny thing is, like, I was targeting a different job, and I was like, almost wouldn't have replied then because I was so sure I was going to get that other job. But I was like, you know what, I'm just going to look at the email, and it went from there.
That's really interesting how you're all different paths to get to where you are. And I'm really interested to know more about how you even move through your path. But before we share that, how did you choose the degree program that you chose to before you got to your career opportunity? Maybe we could start with Wendy and or Alex, whoever, and keep going down.
I can go. So I knew from a very early age I wanted to be a nurse, and I didn't really know in what way or what part of nursing I wanted to do. So I did an internship, and I know we're going to talk about that later, but and that helped me sort of determine what part of nursing I wanted to be a part of. But then as I got older and saw more of what nursing is, I realized that I really did want to do more in the public health arena, and be able to impact patients, not just in the critical care space, but in all areas that they would, encounter healthcare needs.
Gotcha. Thank you.
So mine's an interesting story. I initially started at UNCG intending to go through nursing to become a nurse, similar to my older sister. But once I realized just how much chemistry and math is involved, I was like, I don't think this is for me. Math is my weakness. So I think for about a year and a half, I kind of just was floating between different ideas, trying to figure out who I am as a person, what I want to do with the rest of my life. And really, one of the advisors who was just trying to give me a hand suggested public health, that more people were getting interested in it. And I was like, what is this? What are you talking about? So I think I missed the sign-up deadline the first go round, but I made sure to fill out all my gen eds and just keep an eye on everything. So once it came back around, I applied and I got in. And once I realized, okay, I see what you guys are doing and I like this. So it just kind of stuck for me.
Thank you. Chinwe.
And I have a really similar story, Alex. I started as a nursing major as well. And I actually got into the nursing program and I actually did clinicals and all that stuff. And I was just like dreaded, like I didn't like bedside care. I knew that I wanted to be in the healthcare field, but I didn't know what else I could do if I wasn't a nurse. So I just had tried to push through. But at the end, like it didn't work out. And I felt stuck for a little bit because I was like, I don't know what else to do. And I don't want to like do anything else if I wasn't in the health field. But then I talked to like my advisor and then he talked about public health. And I was like, what is public? Because I hadn't heard about it. And so I ended up switching my major to health education and promotion, and then naturally went into like my MPH program afterwards.
Thank you. Yes. It's interesting how you have so many similarities in your pathway as well.
I was just about to say that I know for myself, well, I'm able to relate to all of y'all. Public health wasn't my major at first either. It was nursing as well, but nursing, it does take a lot of work, a lot of dedication. So does public health, but once you find that niche, you know what you really like. So with that being said, now that you've established what you wanted your major to be, what internships did you take? If you could talk a little bit more about that, and then what advice regarding looking for internships would you have for current public health students?
So for me, when I was like doing my undergraduate studies, I did an internship in like a local hospital as a health coach. And so that internship was more going to the patient's home. So it was a lot of home visits and like helping them work through their goals, health goals and things like that. And then for my master's level, I did an internship with Wake Forest Baptist Health through the Department of Inclusion and Diversity. I was a research intern for them. And they had like this brand new framework called the National Class Standards that they were trying to like incorporate into their, policies and procedures. And so I was helping with the research as far as how they would implement this framework into the organization. So that's what I did. As far as like advice for an internship, that's the other question, right? I definitely start early. Like if you know that you're going to do an internship, if it's required or if it's something that you desire, just start early because that gives you leverage as far as like thinking through what you really want to do. Because if I think that you should really get the skills that you're ultimately wanting, and internship is a good way to get in a safe environment. There's really no pressure usually. It's a learning environment. So I think you should really think about what you desire to do at the end and then target organizations that would give you those skills. I would say that my internship, the skills that I got from my internship, I really did what I'm doing now, the data analysis and the recommendations. I'm literally doing the same thing with this job. So I think that my internship really prepared me for the job that I'm doing right now. And also, apply to different places. Don't just do one. Because for me, like I started late and I just did a few places, but then you don't want to get to a situation where like last minute and you're like stressed out. So really target different organizations and I know that money is a factor, but sometimes, I know, sometimes it's okay to do free internship. It's really gonna get you where you're going sometimes. I know we get hung up on the financial aspect and I understand that, but if you really want a skill, it's only for 4 months. If you can afford to do it for free and it's gonna give you the skills that you need, that you have to think about the future, I think it's okay to take it if it's gonna get you to your end goal.
I like that response. I love that response. Definitely got to start early if you can. Yeah, I definitely like that response. Alex?
So I was going to say, my first and foremost, start early. Do not put it off. That's what I did. Really think about what place you want to go. And like Chinwe said, apply to many places. Don't just bank on one and think you're going to get it, because more than likely they have other students applying for the same thing. So you're in competition with others. So really be on point and start early and start looking early. Let's see. I was interested in mental health from the beginning. So trying to find an internship for me that coincides with public health, so like I can merge the two, was already kind of difficult, especially finding places that would be open to taking on a student who's coming from public health, when a lot of organizations are like, well, what are you doing? What does that actually mean? What can you do for me? Kind of thing. So when I applied to Mental Health Greensboro, back then we were called Mental Health Association of Greensboro, I really had to kind of pitch myself and say, this is what I can do for your organization, and these are the skills I would like to learn, and like work with the executive director. And she really appreciated that. One thing, and I will tell everyone that she always tells me, is if you're sending out an email for an internship, state what it's for, what you're going to be doing, for how long, and how we can help you out. Because she gets emails a lot from people just saying, I would like to do an internship. Doing what? In what capacity? What are the goals you're trying to reach? If you don't at least offer that information from the get-go, it kind of looks like you're wanting us to do the work for you. And so that kind of knocks your chances down a little bit when it comes to a specific organization. I will preface by saying that. But yeah, so for me, it was a little bit difficult trying to find how to merge my two interests, so public health and mental health. And so my options were already limited. And then I waited till last minute. So again, I do say I was really lucky when I applied here, and they were like, yeah, you know what you're doing is something that we're interested in. We can help you out, and let's do this. So that's been my experience so far.
Alex, it looks like there's a couple people asking you to repeat those 3 things to put in the email.
Oh yeah, sure. So we do get a lot of people from different fields wanting to internship with us, whether it's someone who's looking to work in substance use to help out people dealing with all different types of substance abuse and mental health issues. Some people looking for clinical stuff that we don't provide. So do your research on the organization you're looking into to make sure they can offer you what you need and it aligns with what you're looking for, because this is an opportunity for you to gain that skill set you're going to want to use in your career going forward. So make the most of this as you can. Use this as a really good opportunity to reach out to others and network while you're doing your internship, because if you reach out to an organization and say, hey, I'm an intern and I would like to do more information, I'm doing my internship here, but I also want more information about this other place, it gets you the foot in the door to talk to more people so you can network. And then once you graduate, there's other places you can reach out to outside of just your internship. but definitely state what it is you're looking to do with your internship, how long it's going to be, and what kind of hours you were expecting and they can expect from you. And definitely mention kind of how you both can benefit each other, what you can do for them while they're helping you out, because that kind of just sweetens the deal and makes you a more appealing candidate versus others who may be just saying, I want to do an internship with you, and they leave it at that.
Awesome. So for me, like I said, I knew from a very young age that I wanted to be a nurse, but my mother wasn't convinced. So she actually said, go do an internship while you're in high school. So of course that was unpaid, and it was short, but it was at Novant Health. And the only internship they had left was oncology, which is cancer, for anybody that doesn't know. And I was like, oh no, I don't know about this, but I fell in love with it from minute one. So that was one internship I did. And then I went through nursing school. So for those of you that are thinking about nursing, I always say get into the hospital before you go in, so you know if you can handle the blood and the people and all the things that are hospital related. And then once I made it through nursing school, toward the end, I knew I wanted to move to Charleston. And so I didn't have a job, but I wanted to move there. So I did. And I wanted to go into critical care, but they didn't have a position at the time. So I did like was said previously, and I pitched myself to them and I said, I can do this for 2 months unpaid. Just to show you that I can add benefits to your team. And so I went in and I just gave them everything I had and a pedal on the line because I knew it's where I wanted to be. So know what you want when you go into it. If you don't know what you want, that's okay too, but let them know that up front that you're exploring and you're not sure, but you want to learn from them. And that's okay. I did know what I once wanted. So I was very assertive with that and made sure that they knew that I wanted to be with them. And like Chinwe said, I was able to do it for a couple of months unpaid, which definitely sweetens the deal for them because they're getting free work. And so I did that. I was a CNA already, so I was actually able to do a lot of CNA duties, even without being paid as a CNA. So that helped as well. And then when I came back from Charleston, of course, I already knew there were two entities in Charlotte, Novant Health and what's now Atrium Health. And I had never set foot in Atrium. All my clinicals were at Novant Health. And so I didn't really know what Atrium had to offer. So I did an internship there as well. It was paid, but I did an internship just to see, back then, I think it was called, I don't remember what it was called, but basically you got to rotate through several different types of units to see where you wanted to apply. And that was really interesting because that let me see the two different cultures of Novant Health and Atrium and let me determine where I wanted to work without committing to a job. And I did end up going back to Novant Health where my roots were. But I definitely say plan ahead. I definitely say cast your net wide. So that you can kind of see what your options are, see what you're interested in. Every workplace is going to have a different culture. And so making sure that you fit into that culture and that, I would say better, that culture fits you and your personality and your work ethic is really important prior to sort of signing on the dotted line for a career. So I reiterate everything everyone else said, but also say, cast your net wide and then be able to advocate for yourself and know what you have to offer them.
Yeah.
I also wanted to add, I'm sorry.
Go ahead. Mm-hmm.
Like internship, the way I think about internship is an active process. I know a lot of people think your work ends once you get the internship and you've started, you're just marking your hours. Okay, 20 hours this week, 20. You need to do your job, but at the same time, you need to pay attention to, especially if you're in person, even remote, honestly, take some time to get to know the people in your internship site. Take some time to go into the offices and do informational interviews, network before and even during your internship. You might not get a job there, but you're setting yourself up to even other opportunities that they may talk about. So be active and be intentional during your internship as well.
Mm-hmm. Yeah, Y'all are dropping gems here. Thank you for sharing so much and honestly about your experience. And so it'll be interested to know, how did you, manage that, the unpaid time and having to take care of your responsibilities too. So if you had anything to say about that, we can, or I have another question for you, but is there some ways that you managed having, because I appreciate what you're saying about getting the skills from a free experience, but because that helped you for what you ultimately wanted to do. But how did you balance that, working for free and having to cover other things?
So I had a GA-ship. So I was doing my GA-ship, which, I had another income. So you can't do free internship if that's all you're relying on. Obviously, that's number one. I think that you should try to go for paid internship because obviously that's a more sustainable option. But if it's just free options, make sure that you have something else saved up or actively, like, you're working as well alongside with your internship.
Yes, I would say I also had another job as a CNA at a different location, all through nursing school, as well as when I had my internships, because you got to have income, right? And so just no sleep. I think when you're young, you can do that. I don't know that I could do it now, but I just worked really hard knowing that there was a reason and a purpose behind that work. I was doing it to get my name out there. And like Chinwe said, to market myself for the career that I wanted. So there was a purpose behind that double work experience, so to speak, that I was doing. So I think just keeping that goal in mind helped me be able to have to work and do the internship where able, but it's a lot of managing your hours and figuring out where you can have things fit in. I was also very upfront and honest with them that I did have a job, so that they would know that if I wasn't able to come into my internship, it was because I was actually working. I wasn't, going to the beach in Charleston, although that would have been fun too, but.
Yeah, thank you.
For me, I knew off the get-go that the internship would take a lot of my time. So I made sure to, the previous year, to do as much classes as I could. That way I'd have less schoolwork during the internship, so I could better balance going to work and doing my internship. And again, echoing what Wendy said, being honest with your employers and with the internship site about your two responsibilities and how you're going to be juggling both, and that they should expect or should try to be a little bit flexible with you. So really being honest about that and being honest with your preceptor.
Yeah. Thank you for sharing that, because that's kind of where I want to go next, is that after you have accomplished such a major task in the internship, and if you're working at the same time, I heard you, my question will be about what advice do you have in getting job opportunities? And you shared some of that already. In Chinwe, in your story, you talked about LinkedIn. And then Alex, you shared about how your preceptor was changing jobs, but I want to know a little bit more about those details and what was that like to find the LinkedIn? How do you look for jobs after you've got your internship experience? And Alex, I was just going to share too. I remember, Alex, when I checked in on you when you were on your internship, and it seemed like you were taking over the whole organization. I was like, good gracious, what? Alex? So I was the internship instructor when Alex was doing her internship in 2017. And when I checked in to hear what she was doing, I was like, whoa, you're running the whole organization. What's happening? So, but what happened after? So they noticed your your work ethics, but then what did you do particularly to get the job opportunity though? And then we can hear from everybody.
So the position of the person who I've kind of adapted it to my own at this point, which is something else I want to talk about a little bit, about like putting your own ideals into the organization and working with them. It's really flexible since I'm in a nonprofit world. I can't speak for everywhere, but it was right when I was finishing my internship, and I had kind of started a couple projects that I created in a way that whatever intern was stepping after me could continue, like a volunteer for them, not specifically just another public health intern. But the executive director really saw how much work I was putting in and how much of my actual passion was behind the projects I was working on. And then the role of the person in my position, right, was really aligned with what a public health student does. And so it was kind of like, take A and put them over here and like just slot them in, because I was already doing what she was doing and I was working alongside her. So it was kind of, okay, here's me proving what I can do this job as well. And of course, I really got along with all the rest of the staff. I really kind of dug my way in to make sure I know the inner workings of how the nonprofit works, because I just wanted to make sure I know everything about this world. I know how it rolls. I know how potentially to start my own in the future if that's ever something I want to do. So really working closely with my preceptor. And so she just really took a liking to me about what I could bring to the organization. And since I was really pushing my own passions and my own ideas, I was kind of helping the organization out also, and building up their reach out for the Spanish speaking population as well. That's something else I could bring. So it really just ended up being like, oh, this is perfect.
Oh, thank you. Yeah, what were the other steps you all took between after the internship to get the job opportunity?
So when I was doing my internship, I mean, my plan was to hopefully get a job over there. So, I mean, when I walked in, I'm like, I'm gonna do my best to put my best stuff out there. And I think your preceptor is really your ally, if you think about it, because I was really open with her about the fact that this is my goal. This is what I was wanting to do. So I took the initiative to like reach out to other people where I was the company, but also she sent out like this mass email. She was also like helping me like reach out to people. So I had more informational interviews that way. Ultimately, the job that I had came before others. So, but that's one of the ways that you can get to know people, because my internship was remote, so I didn't have that option of just walking to the next room to meet the next person. So I had to just make use of my preceptor, and also like if I had a meeting with like a group meeting, I write down their names and reach out to them and things like that. So I was proactive as far as like networking while I was doing my internship. And then I think most of the job search for me, I did a lot of networking. So that was just my approach to it. Just talk to people and they recommend you to like, oh, why don't you look here, and things like that. And then it goes from there.
I think for me, the piece that I learned during my different internships is that even if you're not able to get a job at the place you're having your internship, it's amazing how connected people are with other places. So your preceptor or people in that same company, if they like you, they're willing to promote you to other places if they don't have a job where your current internship is. So just keeping that in mind and asking them to do it. I had no problem asking, like, do you mind writing a reference letter, or do you mind sending this out on my behalf? And so as long as you're showing your worth and what you can offer, usually they're willing to do that. So even though the place that you do your internship, maybe it's small, or maybe they don't have a place for you once you're done, it's amazing how connected everybody in that place will be to other organizations. So just keeping that in mind and advocating for yourself in that way.
Thank you. Again, dropping gems, just dropping the gems of wisdom. Thank you.
And just to add to that, again, your preceptor is going to be your best friend and your strongest asset. So the more you work with them, the more skills they can impart on you, the more connected you can get through their connections. So really don't be afraid of them. Even though when I got to my internship, I was a little bit afraid of her because she's the executive director of this organization. She's the top dog and I'm just the little intern following her around. But really make that connection, and they're there to support you. That's why they took on this role. So don't be afraid.
Thank you. Yeah.
Yes, like Professor Young was saying, the responses that we're getting, y'all are hitting it pretty hard. So based off the conversation, making sure I get this right, I want to make sure we're networking, where we have that connection with ourselves and the organization and preceptor. And so all three of y'all seem very passionate about what you do in the public health field. So that does bring me to the next question for today. How are you, the work that you're doing, how is that involved with public health?
I guess I'll jump right in. So the biggest portion of my job involves just community education and specifically behavioral health education. So I regularly put conferences together or half-day workshops that are about different mental health topics. I work with the library to do monthly series. We host a monthly series here for behavioral health providers. So a lot of the bulk of what I do is just general community education. So I really benefited from my public health background because I was like, okay, I know what it takes to talk to the community. I know how to structure my words. I know what kind of language to use and how to adapt that depending on my audience. I never had a fear of public health speaking, so I could be out there in front of a bunch of people just going on and on about whatever. And I owe that to a lot going through the program because I got those skills there that I could then utilize in my job. And so just really understanding health literacy, health equity, how to talk to people at where they're at, not make assumptions, listen non-judgmentally to what they're going through, because we see a lot of people from all different walks of life, but we primarily serve an underserved community because we provide our free services. So that kind of just entices a different crowd of people than those who can actually afford to have insurance and pay for health assessments in that case. But I owe a lot to the program, to the skills I learned there, to my teachers that helped me out and just gave me that skill set that I could then adapt to working specifically in the mental health field. Because the neat thing about working in public health and becoming a certified health education specialist is that you develop a set of skills that are moldable and adaptable to a wide variety of places. So if I had not been in mental health, I still have the same skill sets I can use to go work in like the sexual health department or go teach about diabetes to certain communities. So it's a skill set that you really need to take advantage of, and that is really varied. So it opens up a lot of doors for you. I kind of rambled for that, sorry.
And I didn't ask her to say that, so that's all on her own to reflect. But yeah, sorry, keep on going. I'm just happy to hear your experiences.
Did I answer the question? I feel like I lost the plot a little bit.
No, you answered it.
Okay, cool.
I'm also glad to see. It makes me feel good that someone who graduated in 2017 can come back a few years later and share with us how great of an impact this department has been for your career. So that's very, very encouraging for myself, someone who's about to graduate.
Yay.
And I think, yeah, I wanted to hear more about how your jobs relate to the public health field. So I know you have specific kind of specialties. We heard about mental health, but how in Chinwe and Wendy, how is that relating to public health in general?
So my organization is a health information exchange network. And so our target population, so to speak, is hospitals and different practices around California. And so we're making sure with our tools, they're able to have access to patient information who reside in California. And that way, like I said earlier, they're able to provide care on time and not incur more costs for the patients and things like that. And so what I do is around evaluation, around data collection. So I create data collection tools to get information as far as how the tools that we provide for our participants, is what we call them, are useful for care coordination and quality of care that we provide for their patients. So when I get that information together, I compile them and do data analysis on them. And also I'm running an evaluation to measure the impact of our tools. And so, I just pulled out my notes from my evaluation class last week. and using logic models to put everything together. And so what you learn in the program, you're going to use them. Do not throw your notes away. I still have all my stuff, and I still pull them out when I need to.
So my journey is obviously different. I don't have the public health background as far as school like you all do. Like I said, I went to nursing school. Never thought I would do anything besides either critical care nursing with my 1 or 2 patients a day, or med-surg nursing, 5 or 6, maybe 7 patients. But then something sparked in me that there was more. And so I realized, I thought to myself, if I can impact 7 patients a day, what if I could teach nursing and instead impact all the patients that those nurses touch? So first I became a clinical coordinator, which is like a charge nurse. And then I became a nurse educator. And so I was teaching young nurses after they've graduated nursing school, but they've come to us and they're new to being a nurse on the floor, and teaching them what it's like to take care of patients and the things that they didn't learn in nursing school that are like the real life nursing things that everyone needs to know. And so then from there, that got me even more intrigued. What if I could impact even more people, more patients through our organization? So then I started looking at data, and like Chinwe, I became very interested in data and looking at data, because data spoke to our executives in a way that a nurse telling a story didn't. And so when I started looking at data and I would bring data to a meeting, it was like people listened and people thought, oh, okay, I hear her now. And so I started doing data. And when I started looking at data, I started realizing that there was definitely disparities in care. And that's when that sort of started being seen in communities and being more of a hot topic, I guess. And so I started looking at that. And so at Novant Health, we do look at several different aspects of patients when they come into us, whether that's gender, age, sexual orientation, payer source. And we have several different things that we look at, and we look at outcomes and we see, what does that mean for our community? Are our communities experiencing Novant Health the same and having the same or better outcomes based on that dimension of diversity? And so that's what I do now. Again, I do focus a lot on the LGBTQ element of diversity or dimension of diversity, but I do look at all of them in different ways. So we may look at, for example, pneumonia outcomes. So if a patient is admitted to our organization with pneumonia, is a white patient, an African-American patient, a gay patient, a self-pay patient, are they all going to have similar outcomes based on receiving the same or similar care? And so we find that they may not, depending on the way things have occurred through the history of our organization. And so what can we do to change that? And that's where our department really gets involved. And we say, there is a difference and this is what we need to do about it. And the really cool thing is we've seen some great outcomes. Our pneumonia project, for example, we found that our readmission rates were very different for white and African-American patients. And so what did we need to do about that? And why is that? And so we really it was a long project because we had to figure out the why and what we could do about it. And now all readmission rates are lower, but that gap closed. So there's no longer a care gap. So that's sort of how I impact public health. Again, I don't have the degree, or I didn't start in school, but I think that's a really cool thing, because it really was just a passion of mine to go down this road. And I didn't know that in college. So if you don't know now, that's okay. You'll figure it out.
Yeah, this is great. Thank you so much. And congratulations to your center for that success that you shared on eliminating a disparity in care. And for an educational point, would you share more about what readmission rate, just so people know what you closed in people who had pneumonia?
Oh, yes. I'm sorry. I forget that we're all on different different terms as far as language. So readmission rates for us is 30 days. So if a patient is admitted to our organization anywhere in our organizations, we have 13 hospitals with pneumonia. and then they're discharged. We count their days of discharge. So how long are they home before they come back? Hopefully they don't come back. But if they do they come back within 30 days? If they come back within 30 days, that means that we need to impact something different, because we know within that 30 days, there's something that we could have done differently upon discharge that would have most likely kept them from coming back to our organization.
Thank you. Yeah, and to have eliminated difference on that
Yes.
specific data point.
Yes. So when we started, just to expand just a little bit, if you don't mind, when we started, there was a 7-point difference between readmission rates for 30-day readmission rates for white patients and African-American patients. So 7-point difference, which is significant. And so we didn't really know why. At first we thought, is there something we're doing different in the hospital? Are we giving different medications? Are these patients coming in sicker? Which is oftentimes what healthcare providers will say, oh, the patient must have been sicker. But that wasn't the case. And so we really had to figure out, well, what do we do? Because there was nothing in the actual data that showed us what the difference was. So we ended up, myself and another transcultural health manager decided to call 100 patients, 100 white patients and 100 African-American patients, and ask them either what kept you out of the hospital if they had not returned, or what brought you back. And so there were several things we found, but all of them were related to their care after the hospitalization. So they either couldn't get their prescriptions filled, so they didn't have their antibiotic, or they returned to work very quickly, so they couldn't get their follow-up appointment. So there were just different things like that we needed to address, or they couldn't get to a follow-up appointment because there wasn't a bus route or there wasn't a cab voucher. And so there were just different things that we needed to address. And so there's a whole thing I could talk to you about that, but there's lots of steps that we went through to sort of eliminate those care barriers. And then we did end up closing that gap within a year.
Ooh, thank you. Within a year, because I know it takes 5 years more to really make it more equitable in the outcomes. And so my next question is kind of related to this. Thank you for sharing that, is about what types of training, certification, or even next level graduate degrees help in doing the things that you're doing. What advice do you have about either having your certified health education specialist certification or having a master's in public health, or what kind of training in diversity and equity helps to the place to where you are now?
So I don't have a master's degree. And I would say that if you're going to get your master's degree, I would get it right after you graduate from your bachelor's. And they told me that, and I didn't do it. And then I started a family, and I have twins and another child. And so there was just no space for a master's degree. But in the interim, until I can go back and my life settles and I can go back and get a master's degree, what I did pursue was a certification in diversity, inclusion, and equity from Cornell. And so I would say pursue things like that would elevate your career and give you the education experience that you need for the focus that you want to have, that you have the time to do. I think master's degrees are great and very important. In our organization, they're not as mandatory as they used to be. So for example, myself, this position would have been a master's degree position previously, but we have found that I've been with Novant Health for now 15 years, is just as important or more important than the master's degree that I would have gotten in the interim. So since I've pursued other certifications, that sort of gives me the education that I need in order to continue doing this career. But I would love to hear others' positions on master's degrees.
And or certification. Oh, sorry, go ahead.
I just want to say, for you to not have a master's degree, you definitely can't tell by the way that you're passionate about what you do and the work that you have done within your community. You definitely can't tell that you don't have a master's. So great job.
Thank you.
You're welcome.
Thank you.
So
for me, I do have an MPH, and I graduated from my undergraduate in 2018. I took a gap year, and then I did my master's. But when you don't have a ton of experience, one way for you to I guess beat that is to get your master's. because most times in the work field, like a master's is equal to like 2 years of experience. And so once you come out with your master's, you do have that. And then I took my chess. So I graduated in May 2018. I took my chess my last semester of my undergraduate. So I passed the first time. And honestly, like I used like my class notes, and then I used like the recommended book that they had on their website. And that was what I did as far as like studying for it. I find that, I mean, when I took it, I knew that I wanted to work for a year. So I was like, I just needed help anywhere I could get. I was like, I'm going to take the chess. And so that way I'm like excluding myself from positions that required chess. And so that's the reason why I took it. And, you know, now my current job, I don't really need the chess, but if I do need it, I have it. And then another reason why I took the chess was they had continuing education credits that you have to keep up with. And so that keeps me accountable in a sense, like I have to keep learning to meet their requirements. And I love to do that as well, but just knowing that you have to meet this requirement also pushes you to do it, like not to push it away, like, oh, I'm gonna do it when I have time, because you're never gonna have time. You have to create time to do what you want to do. I also have, so I recently got my certification in healthcare data analysis. And so that's kind of like in line with what I do. I just figured that I should take the course. I just took it on my own. I have, I took one in contact tracing when, you know, COVID was like in the middle of the pandemic. I took that because I was like, it's relevant. I have one in diversity and inclusion. And I did my internship with the Office of Inclusion and Diversity. At that point, I was like, I need to learn more about this. So I did a certification in that. And I did one with like the domestic violence, because I like my GHship was in wellness. So I find myself in different spaces and I'm looking for ways that I can improve myself as far as like getting certification in that area. As far as the MPH itself, I think it was very, very helpful, because I think your undergraduate like level, it's just scratching the surface. But when you get into the master's program, you really go in depth and you're able to really define your interests and do more research in that area. And so I found it very beneficial. I feel like it really prepared me for, you know, careers in public health.
Thank you. And Alex, about your chat, thank you. Great.
So I only have my bachelor's in mental health, in public health. I don't have my master's yet. It is something I'm thinking about pursuing in the future, but for the moment, I just don't need it. I am pretty comfortable in my job, but I do think in the future, if I were to expand and look elsewhere, that is something that would work in my benefit. I wasn't really hung up on going into my master's directly after my bachelor's. I wanted to take about a 2-year break, get my feet in the ground, learn how the world works before I would approach the master's program. And then just to approach it from having a developed skill set. And I did take the CHES exam my last semester. I think everyone was taking it, and so I was like, well, I'll take it too. And I just pretty much relied on my school notes, on my textbooks, and I passed, so I'm here. So I don't have my master's, but again, it is something I'm looking forward to getting in the future. As for certifications, I really just got some that are pertinent to my position here. So I am a certified mental health first aid instructor. That one I just got 2 months ago. And I am a certified suicide prevention instructor as well, with a nationally recognized program. And so those two are really relevant to what I do, because I do teach courses about suicide prevention. I do speak publicly about it as well. And mental health first aid.
Mm-hmm. Thank you. And I know that's a growing area, the mental health first aid. So that's interesting. Thank you for sharing all of that. Again, we're so honored to have you share about your experiences. And I think I'm gonna pass it to Brittany, who has another question for you all.
Yes, it's very interesting to see that just because you're not CHES certified or don't have a master's, there's a path for you to take for a passion that you really have. So it's very interesting because y'all are all on 3 different paths, but y'all all are working together for the common good of the community, which is great. With that being said, within the community, we do see COVID starting to take over. So how has your career been impacted by COVID?
I can start. So I can speak. Well, I think we all have seen how nursing has been impacted. And I was telling the group before we started that I recently went back to the bedside twice in critical care just to help with the patient surge and the nursing compassion fatigue. And so being able to stay flexible is huge when we have something like a pandemic occur. And so for me, being able to stay flexible and being willing to go back to the bedside was very important. I never wanted to lose my nursing bedside skills anyway. And so I've kept those up in different ways through PRN roles in the hospital and in hospice. So that's one way that nursing as a whole has been affected, and then me as a nurse. But in my career as a transcultural health manager, I had to get very creative. Prior to the pandemic, I was hands-on with our community. I was out in the community. I was meeting with patients one-on-one, meeting with families. I was meeting with our team members, doing education in their teams, going to the ORs before they opened and coming into clinics after they closed. And really it was face-to-face education. And I have found that when you're speaking to people about diversity, inclusion, and equity topics, face-to-face is always best because you can read the room, you can really get a sense of how people feel about the topic versus Zoom, where someone can turn off their camera and be doing laundry, and you're not really sure if they are impacted by what you're saying or not. And you can't tell if there's a certain feeling in the room that you need to address that isn't verbally being said. So I realized I had to get pretty creative to keep this role impactful. So obviously I do a lot on Zoom. So I do meet with patients and families via Zoom, or even like text messaging has become a part of my life with patients that I never thought it would be. But just having that quick contact, especially with our younger generations, texting has been very positive. And then the one thing I've done with our team members is I make sure that they know up front that I'm going to need them to have their camera on. I am an introvert, and so having my camera on is difficult for me. And so I like for them to know that about myself. And I like for them to know that I would like to see their faces, and this is why. If you need a break from the camera, I tell them absolutely take your break. But in order for us to both learn from each other, I would like to ask that you have your camera on. And some people still don't, and that's okay. But it's really hard as an educator to make an impact when you're looking at a name instead of a face. So I like to give that up front where I can, so that people can be prepared. There's nothing worse than going into a meeting where you think everybody's going to have their camera off and you're in your pajamas and everybody's camera's on and you're like scrambling to get some clothes on and some makeup and brush your hair. And so letting people know up front is always important for me. I also like to let people have something to, I say chew on, but to think about prior to us starting. So whether that's a video, I like to use videos way more than I ever did in the past before pandemic, because the face-to-face was enough. But since I don't have that, I like to use videos. So I'll send video links out to team members ahead of time and say, this will take you 3 minutes, nothing more, sometimes 1 minute. Just take a look at this video because we're going to talk about it. And that sort of just gets feelings and emotions going in a way that normally that face-to-face interaction would have done pre-pandemic. And then I think just having the awareness of the fact that everybody's been impacted differently by the pandemic, and knowing that you really do have to meet people where they are way more, in my opinion, than ever before. So for my patients that I interact with pre-pandemic, I didn't worry too much about whether or not they had a phone because I knew I was going to see them face to face. But now that's one of my first questions. Do you have a phone? Which honestly, before the pandemic, I thought everybody did. Even if it was a flip phone, I thought everybody had a phone, and they don't. And so having that question of, do you have a phone? Do you have access to a phone? If not, where can I meet you? And so just making sure that I'm doing that extra step to meet people where they are. So that was my learnings or impacts.
And for me, pre-pandemic, I was just a first-year master's student. And so the beginning part was just more self-care and just trying to get through like my classes, like, you know, most people on this call, you know, being a student and navigating that. And then once I graduated in May, it was about even before that, like trying to figure out how to transition into like the work field. And I had all my, like everything that I did was online, like the interview process, which I think was an advantage because they didn't have to like travel a lot to do interviews and things like that. So that was, I think that was a positive. The job search process wasn't as, you know, daunting, if that makes sense. And then now, even in the workspace, I mean, I'm here in Greensboro, my company is out in California. And so there's already a huge like distance. I'm working on, I work Pacific time and leave in Eastern time. And so being able to adjust to the time difference as well. But, you know, being able to work remote and just the structure of like the work field now is just so different. So being open to the fact that there's more out there, like not restricting yourself to just Greensboro and things like that. And then specifically in the work, like we had like a user group meeting, like a focus group where we collect like data from our participants. And yeah, like it's Zoom, and then you have people, their cameras switch off and it's like not very engaging. You don't even know if they're like, you don't know if they're there, or they're paying attention. And so like, it's sometimes harder to get like data from people when you don't even know what they're doing. And so it's been like being able to be flexible with, meet people where they are in the process and just do what you can sometimes.
Can I get the question one more time?
Yes, ma'am. How has COVID impacted your career?
Okay, so like I mentioned before, primarily my job is to go out into the community and big events and talk about mental health and do presentations and run classes like that. So once COVID hit, that all kind of got nixed because we're not supposed to be gathering. And so I was really fortunate that I was able to be flexible and switch into a more supportive role for everyone else here at the organization who's doing different stuff than I am. So I took a step back from doing presentations in person to, okay, let's do this virtually. First, it was, okay, what is Zoom? Get used to that, get used to the structure, get our clients used to that structure as well. And again, try to accommodate those where they're at. If they don't have phones, if they don't have computers, what can we do for them? That way they're not cut off completely from us if they can't be here in person. So it was a lot of just researching and trying to figure out, okay, what else can I do to help the organization continue forward if I can't fill out the role that I'm supposed to be doing right now, which is, again, that community health component. So it was a lot of just being really flexible and adapting, being like, what else can I be doing to help everyone? And eventually now all of our services can be adapted via Zoom. So we find that really beneficial, but we do talk about mental health. And so there's that component of being really vulnerable with someone when you're opening up about your specific traumas, what it is you're going through, and again, how COVID is impacting you. And we find that it's better to talk about that in person, where you can offer that comfort of being there with them, and a physical comfort as well, putting a hand on a shoulder or something. It just makes it more impactful, and you can make a much better connection with someone when you have that, versus talking to them via screen where you don't know what's going on and you can't reach out to them, you can't help them out through their distress. And then again, if they do turn off their cameras when we're having events virtually, and I'm like, I'm just talking to black space, okay. And I'm also an introvert. I know it doesn't seem that way. I have my moments where I get a lot of high energy and I'm like, it comes out. Really works for the job, but I don't want to badger people to turn on their cameras, because I wouldn't want someone doing that to me. So I'm kind of like, I want you to turn your camera, but you don't have to, but I would really like it if you did, but I understand if you don't. So I haven't been pushing it lately. I just kind of roll with it and make sure I keep my camera on at least so they can get my visual, and I can talk to presenters when we do our workshops and stuff. So it's been hectic. It's been a really large learning curve, but we've made it work.
Yeah. Well, thank you so much. We're probably going to wrap up our time of talking so that we can get some questions from the audience in just a minute. So let's ask you one more question. Thank you for sharing about how COVID has impacted you and in all the ways you have to be flexible. And so this last question is about how do you avoid burnout in the process of what you did before COVID, how in the process of working with COVID, the COVID pandemic environment, how do you avoid burnout? Because I remember you're saying, Wendy, in the time when you were in school, there was some sleepless nights that you just had to know your why, but you can't go forever like that, right? So how do you avoid burnout is my question.
Yeah, so knowing your why is huge. And I frequently go back to mine. I actually have it posted above my desk because as a nurse, it's very important for me not to lose that. I am very fortunate that I work for an organization that really takes a focus on our prevention of burnout. And so we are encouraged by our leaders to turn it off if you can, and take that moment for yourself. So for me, like I said, I have children. So when I'm with my children, I'm with my children. I'm not pre-pandemic. Honestly, I would answer my phone regardless of what time it rang. But then I realized I was needing some self-care. And so if I'm with my kids, my work phone is not with me. Obviously, if there's an emergency, I can be reached. But making sure that you do take that time for self-care, whether that's, for me, I love to ride horses. So go for a horseback ride or walk my kids through the neighborhood, whatever it is. Take that time for that self-care, even if that's read a book, turn off social media. That one's huge for me because I get really emotional about the things I see on social media or in the news. And so just taking that time to do that self-care, getting good sleep now is very important for me. Drinking water, eating healthy, all the things that we know, but we don't often do for ourselves are very important during the pandemic. And just even when you're starting a new career, it's extremely important because you can get burnout just from that. And then now you're starting a career in a pandemic, possibly. So I would just say focus on boundaries. So know what your boundaries are. If your boundaries are that you get off at 5 o'clock and that's your time off, then keep that boundary. It's very easy to let that kind of creep into 5:30 and 6 o'clock and 6:30, and all of a sudden you're working until 7 o'clock, 8 o'clock at night. So just try to keep those boundaries and know what they are up front.
Thank you. That's helping me. So, Chinwe or Alex, what are your ideas about how to avoid burnout?
Yeah, I agree with what you said, Wendy. I just do my best not to work outside of my work hours because it's super easy to do. Because you're home, you're like, oh, let me just check this email, and then next thing you know, you're like 30 minutes into like outside your work hours. So yeah, boundaries are important just to keep yourself to have a good work-life balance as a whole. And just do things that you love. I know, like, usually I can't really get out from really Monday to Friday, but usually in the weekends, even if I need to go to Sam's Club and just walk around, I need to get out the house. I need to do something outside my house. So I try to just leave my house and do stuff outside of work. And then just in my workspace, I have like a self-care wall, and it's not anything super fancy. It's just like, I love flowers. So it's like a floral wall with like a mirror, and it's just nice to look at. So it's just things that can calm you down throughout the day, or you just look at like, oh, that's pretty, or just to distract you, you know.
So for me, beginning in my position, since it is the mental health field and it can be quite mentally taxing. I knew from the get-go I would need to have strong boundaries. So when I first started the position, after 4:30, which is when I get off, I'm like, unless it is an emergency, I'm not answering emails. I'm not even going to look at my email. I put my app to sleep because what I do at work is going to be in work time, and then I have me time. And that me time is vital for me to continue being me. So I knew immediately setting that boundary and keeping that distinction was important for me. And that's something I share with this girl I supervise over our teen youth programs. Once you're off, use that time for yourself. Do not worry about work. I do often get the thoughts, I'm like, oh, this thing is coming up tomorrow. I'm thinking about it. And I'm like, nope, that's tomorrow's problem, not today. Today I'm off time and it's time for me to go watch a show. It's time for me to take a walk, go to the gym, whatever it is that's on my schedule for the day. So we talk a lot about burnout in the mental health field, and I've done presentations about it. So I could speak all about this. First and foremost, again, find what helps you out to de-stress and rely on those and plan for moments when you are feeling yourself pretty stressed and you can feel like your body tightening up. You can feel like your thoughts are racing. You can't sit still. You're really stressed, and use those activities to release some of that stress and to get your focus away from work, get your focus away from what's happening in the world, because that can be really overwhelming. At the beginning of the pandemic, we were getting a lot of people reaching out to us saying, what do? I'm getting so frustrated. I'm getting so paranoid and anxious and just scared. And it was like, okay, find out how much information, like if you absolutely need to know what's going on in the world, you cannot just turn off the news. 15 minutes at most, that's all. Look at the news, 15 minutes, turn that off, do something else, go read a book, force yourself outside the house, leave your phone somewhere else, just distract yourself if you at least need that bit of information. Make sure you stick to a schedule if you're feeling like your life is getting turned upside down because you're working from home now. Adhere to a schedule like you would if you are going physically to work, because it does help keep that boundary. It helps your body kind of keep that distinction of like, okay, here's work, time to focus, now time to relax. And it gets more difficult if you do have a lot of other life problems going on, like you're taking care of kids now, and you're now a part-time teacher on top of doing your job. So it really is just trying to find those moments where you can just break away from everything and relax and, use your aromatherapy, read your books, read your self-care books, listen to those podcasts on mindlessly, just something to distract yourself. That way that doesn't become terribly overwhelming. And then for those who are like worried about all sorts of misinformation going out there, just trusting verifiable news sources to get that news.
All right, well, thank you so much. Again, that's helping me. I'm going to take some of that, your advice, which is so brilliant. All of you, thank you so much. And so I'm going to open up to Christina Fudick to let us know what we'll do next.
Yeah, so we had a couple of questions in the chat, so I'll start with those. One person asked, there are people who have told me to wait until I get my master's to take the CHES exam. Is that a good idea?
I think it depends on your goals. If you're going directly from an undergraduate to a master's, then maybe it's not, you can hold out if you want to. But again, there are some requirements you have to meet to write the CHES. If you're in the public health field, I think you'd probably be able to write it. But like, I don't know who is who's on the call, but you have to have a health education background to actually be qualified to write the CHES. But I guess it depends on your goal. I don't think there's a wrong time to have it. Absolutely not.
Awesome. And this next question specifically for Alexandra, what would your master's degree be in? Would it be mental health related or public health related?
I was actually thinking about branching more into social work because I just feel like I could have a bigger impact where I'm working right now if I did do something with social work and I became a licensed clinician. But what I'm finding is my strongest suit is speaking to large crowds of people, not just helping people one-on-one. And I feel like it would put kind of my own mental health into jeopardy if I was doing one-on-one helping people out, because they are really, really high rates of burnout in the social work field. So I've just been thinking about it. I'm not entirely sure where I can go. I haven't looked into specifically what avenues are open to me. I just know there's a lot out there, and I just need to find out like what works best for me.
Awesome. We just have one more question in the chat, and then people are free to unmute or put whatever you want in the chat as well. And for Rosaline, you'll just have to help me out a little bit. What public health certification would you advise, and what is it say what major is on the top market? Can you specify what you meant by that, Rosaline?
Really wasn't was asking what are the top, because most of us, or specifically me, struggling with what is the major top market of master's program, right? So I'm asking this question because some of us may be struggling with what master's program they are going into, so that based on their vision, they can be able to also excel in the workforce, or being able to get a job at some point in their career.
So your question is, what concentration of the public health field is marketable?
Yes.
Okay. I personally have found, like, once you have your MPH, it's a really fluid, you can work in different aspects, except it's something that has to do with like biostats or something that's really like, you have to have certain skills. Marketable, I guess in terms of like money wise, like, are you looking for like high paying public health realms, or are you just looking for just getting a job? I think you have to follow your interests first of all. I think with public health, you're gonna find something for sure. You're going to find something, but if you're looking for something that is higher paying, maybe the data side could be what you're looking for. But I say go with your passion. I think it's more important to do what you love versus just like a paycheck. I don't know, but that's just me.
All right, those were all of the questions that we had in the chat right now. So, and anybody else can feel free to turn your video on if you want, unmute and ask what you want. I know a couple of people had their hands up. Leela, did you want to ask something?
Yes, my name's Layla. I'm a junior in the public health program, and I just wanted to say that I'm in awe of the work that you all do. It's just so fascinating to me how broad public health is and like the different niches you can find. And I'm honestly interested in all of your fields. I'm having a really hard time narrowing things down, as you can see. But my question is, what soft skills would you say are in demand in each of your fields?
I think for us, it's just having like a really personable attitude and being really open with people, being very honest and empathetic. That's just in the mental health field, because people are going to talk about their traumas. They're going to be very open about everything that's going on in their life. And so it takes kind of being able to listen, not judgmentally to what they're doing, because if you're talking to someone and they're telling you what they're going through and you're starting to make faces, or you're kind of like, your body language is starting to kind of close off or something, to them, that kind of signals you don't want to have this conversation, or they're not worth having this conversation over. So in the mental health field, it's a lot of just being very empathetic and being aware of your facial expressions, your body language, verbal cues when you're talking to others. So making sure that you're nodding, you're making eye contact, you're listening to what they're telling you versus staying completely silent. So that's one of the benefits of using our services in person versus over Zoom.
I would agree with all of those. Empathy, being open-minded, passionate, all of the things, being able to articulate what your needs are and listen to what someone else's needs are. I love to be vulnerable when I'm doing consults. So I don't hesitate to open up about myself if it helps someone else open up. And so that's something that's hard a lot of times for people because we're often taught in professional careers that we can't be vulnerable. But I find it very helpful, especially when interacting with patients or even team members that have a concern that they are uncomfortable expressing. So a lot of times I'll tell my own story or express, my own fears. And so being able to be vulnerable while being genuine for me is important.
And for me, like most of my job is internal. So we have the participants which are outside, but I do a lot of internal data analysis as well. So I don't really interact with the customers per se. But I agree with everything that Wendy and Alex have said. Just having good active listening skills is quite important, and being able to understand the needs of those that you're serving, as well as interpersonal skills, being able to like juggle and being flexible with people are quite important skills as well.
Awesome, thank you. And Keandra, I know you had your hand raised. You can go ahead if you want.
Hi, my question was about the CHES exam. So there have been people telling me that there's two types, I guess. So one that you can take for undergrad and one for your master's. If we're not taking that gap year, like going straight into our master's program, would you advise us to just wait to take it like once we get our master's? Or do you still advise us to take it in the undergrad and then retake it again? Or is it the same test? Is it different? Because they didn't really tell me the difference between the two. They just said it's two types.
So you have the CHES, which is for the undergraduate level. You can take CHES as a master's level, but you can take the MCHES, which is the master. I don't know what the M stands for, but I know it's the master's level CHES. Put it that way. If you know, for me, I don't think that I'm gonna ever take the MCHES just because I feel good with the CHES. But if you're going to just go directly to your master's program, it might be worth it to wait and just take it at once. That way you don't do the CHES and then do the MCHES.
Right.
And again, if your work is going to pay for it, you can wait sometimes because sometimes your work is gonna pay for you to take it. So that could be something you can think about.
Thank you.
Now, I'll weigh in just on this part as I'm facilitating too. You could do either. I have the Master Certified Health Education Specialist certification and did the CHES exam as well. And there are different questions on them based on the different levels of areas of responsibility that you have experience with or studied for. And so we can talk about that some more, but I really appreciate hearing from our panelists about their experience as well. But thank you for your question on that and your answer, Chinwe. So great. I'll go back into moderator mode.
Yeah, we have a question from Amber. You can go ahead.
It's for Alexandria. I'm really interested in mental health, but right now my degree is for human development and family studies. And so I was wondering, like, how did you know public health is what you wanted to do with mental health, if that makes sense? Like, how did you mesh the two together to know public health is what was right for you?
Okay, so I was already interested in mental health since I took a psychology, my AP Psych course in high school, and that kind of introduced me to the world of mental health. And really, it was just my passion to learn more about the brain and like how it works and what happens when it doesn't work properly. So I always had that underlying interest. And I initially was going to be a nurse. Like I was in the program and everything, and then I backed out. And I thought about pursuing a career in psychology and becoming a psychologist, but then I was like, that's like 7 years of school, and I didn't really want to do that. So I was like, okay, what else can I do? And that's when my advisor spoke to me about the public health program. And so I just saw the opportunity of what I could do once I was in that actual program, and I could see the skill set I was learning and how it could be applied in the mental health field. And then what positions I could be in. Because again, you're not going to get a position that says, oh, this is specifically for a health educator. You're going to see a wide variety of titles. And really, it just takes looking at what the skills are required underneath those titles and something you can potentially do and utilize your public health skill set for that. But once I kind of merged the two worlds and I was like, okay, if I do go into public health, what can I do that will also kind of scratch that mental health itch that I want to do? And that's when I looked into my internship, and when it really became a reality of, okay, this is something you could genuinely pursue, not just, oh, I put these two together because I wanted to and it worked for me.
Awesome. Does anybody else have any questions? Anything they want to unmute about?
Oh, wait, but I have some more questions too. But
yeah, I have one too. Kind of going back to what Wendy was talking about, specifically about vulnerability in particular. In my kind of daily job as a career coach, I work with students on a variety of different things, whether that's thinking about majors, careers, interviewing, resumes, kind of all of that. And one thing that I think a lot of students struggle with is knowing like what their story is and how to articulate that, especially in interviews. Interviews in general are just like super scary. They're very intimidating. Everyone kind of has like a lot of anxiety around them. So this can kind of be a question for anybody, but what do you kind of recommend for students to just kind of practice like their why, like we talked about before? Like how do they articulate why they're going into this job, why they're doing what they're doing? And I always kind of recommend, like, it's up to you personally, like how, personally you want to get in that aspect. But I always feel like there's some sort of, significant person, an event, something that kind of triggered you going into that specific field. So how do you kind of recommend students practice doing that, I guess would be my question.
So for practice doing it, first I would say try to know what your why is, or your story is going to be. Wherever you're going to interview, I would say know what the business case is as well. You want to be memorable because there's other applicants that are going to come in, but you also so you want to be memorable with your personal story, but you also want to be have a business reason of why they should hire you in particular. And sometimes those are the same, but sometimes they're different. And so I know for me, when I do interviews for other transcultural health managers, oftentimes the people I remember, honestly, it's not their resume. I mean, sometimes there's something on their resume that I'm like, wow, that's amazing. But really it's what either their personal story is, or it's what they can bring to the table that's different from what's already present in our team. And so just practicing, I would say practice with your friends or your family. I love to do case studies or things like that with team members. And have them practice with me, like if they're going to interact with a patient, for example. So I love practice. And then I would say the more interviews, the better. The more you do it, the more comfortable you're going to get and the more confident you're going to be speaking. I also used to record myself. When I first started doing public speaking, I would sit down either in Zoom or in a conference room and record myself speaking. And then I would watch it back. But I would also have someone that I looked up to or respected watch it as well to give me feedback, so that I could have another person's perspective on what they're seeing that I could do differently as well. So I say recording yourself, not just doing it in front of the mirror, but actually recording yourself and watching it back and then sending it to someone else to watch as well.
And just to echo that, really, I remember the first time I ever recorded myself was at one of the student centers, and it was for a presentation I had to do in person. And I never realized how much my body language really spoke about how much anxious I was. So I was fidgeting, I was crossing my legs. Verbally, I just kept saying a lot, so many times. And just seeing that recording of myself, I was like, okay, there's some things I can improve, and I can kind of, you get kind of concerned about like, oh, make sure you don't say in there, and you kind of get into your own head. But the more you practice, you kind of get that muscle memory, and it naturally just lessens. And the more you do it, the less it's there, and the more confident you'll feel about it. One thing I would say is just, you have to kind of play the part of being that confident person, even though you might not mentally be there. So it takes like taking on that role of like, okay, I'm coming into this position and I'm going to tell them what's up. I'm going to give them my life story, and they're going to be impressed with it and blown away. So you might not feel that way, but fake it till you make it, because it does work, because they're going to be like, okay, here comes someone who has a presence. Let's see what they've got to say. And you can use that moment to, okay, share the roots of your passion. Where does it come from? Why are you interested in this topic? For me, it was, okay, I'm interested in mental health, but why? Where did that public health thing coming from? So you kind of whittle it back till you get to like the kernel of where it all started. And for me, it was like, I just want to help people. And that really spoke to my preceptor, who was like, okay, we're in the business of helping people. So I can see there's a connection there. And so everything just kind of fell into place. So it does take some work of finding out what your why is, where that passion comes from, and exploring who you are as a person as well. And like Wendy said, kind of showing them that you guys can work together, that's going to be some type of synergy that you can also, they can benefit from having you on board. Yeah.
And I think it's just connecting your why to the company's why, because your why is your why, but they care about their why. So look at the job description. I don't like to memorize my answers, because then you're just going to be nervous trying to remember like what you know. So get comfortable with the description, get comfortable with what they really want you to do, and then frame your answers to answer like their need, if that makes sense. Nobody wants to know what you have. They want to know what you can provide for them, what value you're going to give them. So you have to remember, what can I give you? What can I give you, the company? And why do I stand out? So.
I do want to ask a question. I'm hearing the words why and the phrase know your why, but what if there is an individual who may be watching today who they don't know what their why is? How would you go about finding your why?
Honestly, I think it's a lot of self-reflection. I don't think it comes just because you want to know your why. You could take like you going through a whole program to know your why sometimes. It could be a life event that brings your why. And so just a lot of self-reflection. What am I interested in, and why am I interested in this field or this area? I think it's a lot of self-reflection, self-digging to figure out, what are you in this? I know there's a lot of deep questions. Why am I here? It's like, what am I on this earth for? And those are the questions that can help you figure out what your why is, but it's not an answer that somebody can give you. It has to come from you.
And I would say to those that don't know, it's okay to not know. And you may even go through your first job without knowing. And you may find it during your first role in your career, and that's okay too. Or like Chinwe said, it may be a life event that happens. So I think it's okay not to know your why. And if you don't know your why for your first interview or your first role, just focus on the business case and what you can bring to that business, and leave that why out. If they ask you what your why is, I think it's okay to say, I'm still figuring that out. But part of figuring it out is me taking this role with you. And I would like to grow with you as I grow in this role. So that's what I would do.
Right, yeah, thank you. I think that really helps to explore all of the advice you have. My other question, unless there's some others out there, was what advice do you have? We talked about LinkedIn. How do you use social media effectively to your benefit of your career? So whether it's LinkedIn or Facebook or Instagram or whatever, what advice do you have about using social media for your benefit in your public health career? Or if you don't use it, because I know we said limit your time on it, right? You know, or not use it at all. What's your advice on that?
For me, I just primarily use my LinkedIn, and I connect with other behavioral health providers and other people just in my general sphere, just connect. I don't really do much on there to kind of promote myself because I do work for an agency, so I'm kind of focused in that role and making connections through that. But I feel if I were to be looking for a different job, then I would absolutely have to work on my LinkedIn game and my Facebook game, and to make sure I come off as professional as possible. Don't have any questionable public pictures up there. So that'd be something I'd have to explore as well.
Yeah, so for me, I have LinkedIn. I don't like Alex said, I don't use it that frequently. I have found that most people find me through other organizations that I work with in the community as a consultant or as a speaker like today. And so that's always important to kind of make yourself available. If it's a topic that you're interested in and someone asks for you to be available, then sure, make yourself available if you're able. I would say definitely keep your Facebook clean. I know they probably teach y'all that now in college, but when I was in college, there was no Facebook. So that was not talked about, but it is something that our HR, people and culture is what they're called now, does look at. And so it's definitely important. Obviously, we want everybody to be their authentic self, and we're never going to say, you know, hey, you can't be yourself on your own personal Facebook page, but you also don't want to have something disparaging about yourself out there. So I think it's important to think about that as you enter a career part of your life. Just sort of cleaning that up if you need to. LinkedIn is great. If you are looking for a job, it's a great way to sort of get your name out there. I'm sure there's other companies like Indeed and places like that where you can put your resume. The one thing I would say in the nursing world is that you could pretty much get any job right now. We need nurses everywhere in every area of nursing. And so that being said, it's important to make sure that you are going to an area that you're going to be happy in, since burnout is so prevalent right now.
And I currently use LinkedIn and Facebook. I follow some professional pages on Facebook related to public health. And then on my LinkedIn, I think I'm still in the process of growing my network as well. I find that if you follow more people in your field, then you're able to see more posts about jobs. So that's the process of building your network. People that have, for example, MPH under their names, or public health, at least, you know, in my case. And then so if there's a job announcement, somebody's going to like it, and then you see it through your feed. And so that's how you can know about opportunities before internally, if that makes sense. But also, yeah, like if you're looking for a job, just make sure that your profile is up to date, because I got my job through LinkedIn, but updating all your job history and making sure everything is on there, so that if a recruiter goes to your page, they have a good sense of what you've done. And then there's a feature on LinkedIn that has the open to work. So use that feature, and also reach out to people on your LinkedIn. Don't ask for a job directly, but network in the sense of, like, you can reach out for informational interviews. That's one way of getting to know people without saying, hey, I need a job, because that you don't know how many of those emails they get, and they're going to ignore you most likely. Look for creative ways to reach out to other people without like blurting out, like, I'm looking for a job. So.
Thank you. And you mentioned about the informational interviews. Like, are there some really successful informational interviews you've done that helped you with networking broader, or what were some of the advice you have about those conversations? Because there's so many questions, you know, you can ask. What would you advise people to kind of stick with, or that you found to help you?
So when I go for an informational interview, I like to ask them if they know of other people I can connect with, because sometimes you might not directly get what you want from them, but they might connect you with other people based on your interests. So you might want to tell them, like, I'm interested in meeting other professionals, and which one would you recommend based on the conversation you have. And then also, like, somewhere in the conversation, you can ask them if there are opportunities they're currently working on. That way you can hear it. And sometimes they might say, oh yeah, and I have this opening here. So just, I know people think information interview is just like a casual. No, you have to go there prepared, because you don't want them to be annoyed with you that you're just here wasting their time. So keep it short, like 15, 30 minutes, but make sure you it's like an interview in a sense, even though it's casual. So have your questions, have a goal for that conversation, and you're the one steering the conversation. If you go there and you're like, oh, hi, they're not gonna, you're not gonna get much from that, but you have to be in that position that you're steering this conversation. I'm trying to know what you've done. I need to know if there are opportunities. I need to know if you have people in your network. Like, that's the way I target it. Like, I need to know those 3 things. And usually, like, if they do, they would steer you to other things. Or it could be the person that you need for your next level. So.
Thank you. Now, I don't know if the other panelists have other ideas, like what types of conversations have helped you with your networking, whether to get consultations, you mentioned out in the community, or otherwise, what conversations help with finding more opportunities or more clients? Alex.
One thing that worked for me while I was doing my internship actually was the executive director actually attends these monthly meetings with other providers. And so I would just kind of tag along and like, hi, my name's Alex. Hi, my name's Alex. So kind of making myself known to everyone. So they're like, oh, they can kind of remember me. And I've had people like, hey, I remember you from a couple of years back. How's it going? Do you want to work together? So kind of attaching yourself to whatever you can to get your name out there, whatever networking circles are available that your organization can get you into. Definitely take advantage of those. And for the informational interviews, again, going in with the game plan, knowing what you want to talk about, what information you want from them that will benefit you instead of just kind of winging it.
And so for me in the LGBTQ community, word of mouth is really huge. And so I just make sure that I follow up with anyone that I've touched in some way to make sure there wasn't something that I needed to do differently. I'm always a big fan of growth, personal growth. And so if I do a consult or I do a presentation or I talk to a group, I want to know if there's something I should have done differently so that I can grow from that. And when you do that follow up, it gives you, kind of puts you back in their memory or their thoughts to recommend you to others or bring you back if you can, if they need you again. And so making sure word of mouth is good word of mouth and not negative word of mouth. And if there is something negative out there, just addressing it up front and sort of learning where it came from and what needs to be done differently. Like I said, love to grow. And so I think as long as you always keep that mindset that you always can grow in some way from anyone that you interact with, you come across as helpful. For when I do consults in the community, that's nothing that I'm not getting paid for it. It's not something I'm charging for. So it's really my personal interest that I'm out there doing this work. And so I think that says a lot as well to others to say, okay, well, she wants to be here. Nobody's paying her to be here. Nobody's forcing her to be here. She wants to come do these things. And so that kind of gets out in the community as well, that I am an ally and I have the community's best interest in mind.
Thank you. That's great. I saw Donna. Did you have a question?
Well, yeah, I did. It's not, you guys have done such a great job of informing our students about so many different topics about your education and your work experience. But my question is actually for Christina Faduke. I know that the career office does mock interviews. Now, do you help students with these informational interviews, like going into an internship role? Have you ever done those type of interviews with students?
Yeah, so we do kind of a couple of different things normally. And it's really up to what you want to do. So we're not really like super structured when it comes to like, you have to do like a full on mock interview, which you can do if you want to, but we will usually ask like, what are your plans? Like, are you planning on reaching out to anybody? Do you have like a specific interview coming up? Or are you just practicing more generally if you haven't had an interview in a while? So I'll kind of just start with like questions based on that, just to kind of get a sense for like where the student is at. But for interviews in particular, we can do whatever you're feeling. So if you wanted to do a full-on mock interview, I would act as like the interviewer. I'll ask you questions. We'll go through it as if it was like a normal interview, and then we'll talk about it afterward. So we can do that. And it can be for something specific you might have coming up, or it could be for just more of a general, the questions that you kind of normally get. The other option would just be to talk about strategies. So that could be better for somebody who maybe hasn't had an interview or hasn't had an interview in a while. Maybe you just want to talk about like the questions that you may get, but maybe you're not comfortable yet answering them. So we can kind of start off with that as well. And then for informational interviews, what I normally like to do is ask students, like if there is somebody in mind that they wanted to do an informational interview with. And the first thing that I say is there anybody that just off the top of your head, is there somebody from your family, your network, a faculty member, a coworker, or something like that, where you would have like easier access to that person. And if there's not, kind of doing a little bit of research in terms of like, maybe their family could introduce themselves or introduce them to somebody that they know. So kind of like a second degree kind of connection. And then I use LinkedIn a lot as well. So I'll kind of just go in, during our appointment and see like, oh, hey, there's an alum who works in this place that you might be interested in. And we'll just kind of like create like a short list of people they might potentially want to reach out to. So they're kind of like a couple of steps, but, and then we can kind of talk about like what you actually put in that message. I'm personally like a big fan of not reaching out directly and being like, do you have a job for me? Because I know that that's not like the best introduction. People are not going to respond well to that. I always formulate it more as like, I'm interested in what you're doing. I'm interested in your path, how you got to where you are. And then maybe later on, like you could ask about opportunities. Are there current internships, jobs that that might be opening up soon in your organization? But it's always good. I always say like people like to talk about themselves. So if you kind of start with that and say like, I'm super interested in what you do. Like, how'd you get to where you are? That's much more of like a personal approach, I think, than just being like, I need a job. Can you help me? So that's kind of how I guess start out those messages. But I'm always a big fan of LinkedIn. I always say if you can, because some people do have like their email address listed on LinkedIn. If you can find them, like in the public sphere of like their email listed on the website or through LinkedIn, either one of those would be fine. But yeah, it's kind of just dependent on like where the student is. So anybody listening, if you're a student, if you wanted to just chat about your options that you might have for reaching out to professionals, I know it seems a little bit scary. It's kind of scary to reach out to somebody you might not know directly, but most of the time, and I always say the worst thing that could possibly happen is they don't answer, or they say, I'm really sorry, I don't have the time. And that's not terrible. The worst thing they can say is no, and then nothing bad's going to happen from that. But most of the time too, I kind of flip it and I say, like, if you were a professional, working in public health and somebody reached out to you and said like, hey, I'm really interested in what you do, you would also probably be like, oh yeah, I'd love to help out or ask, answer any questions that you have. So I kind of flip the script in that way. So students too, when you graduate, think about kind of ways like that you could give back to students who might be kind of coming up into the internship class or are currently maybe like juniors going into senior year. So that's always a really good kind of thing to think about too, is like who has kind of helped you get to where you are and how you can kind of give back. So I know that was kind of a long answer, but yeah. Does anybody have any other questions that they are thinking about?
I didn't really have a question per se, just a comment. I know we had some students who joined the panel discussion today. They were excited to hear from the panelists and were interested in their particular area of interest. If it could be possible that if it's okay with the panelists, if we could share some contact information with the students who joined today, so that way, if they have any more questions, they'll be able to reach out to you.
Absolutely.
Awesome. And I have me, Professor Young, Brittany, Donna, we all have the panelists' contact information. Yeah, if it's okay with you, you can put your email in the chat if you want to. And then, yeah, if you want to, reach out to any of us to get that too, that's totally fine. All right, we have just a few minutes left. So are there any last minute questions, comments, anything anybody wanted to say?
I just wanted to thank our panelists for what they've shared, how you spent your time giving all of your reflections, what you're doing in your professions. I'm so proud of you and just honored that you're back here to share with you. We're always the PHE family and welcoming Wendy and from nursing as well. And so we're just so thankful for everybody that's working on public health, because you are making a huge difference. I don't know all the people that you touch, even with the data in California and people that are going through mental health crises, and then everybody that you mentioned with the LGBTQ community. And that really, like you're saying, makes a difference. How can we get better? And that's even how can I improve along the way? It's a great kind of professional presentation and approach to always continuing to be learners. So I thank you all for what you've done. And I'm so honored to have co-facilitated with Brittany. Thank you, Brittany, did an excellent job. And I'm so glad to have done this with you. And I look forward to what your opportunities will be throughout the rest of this year and after as well. And then I'm gonna pass it over to Donna and Christina. Thank you for all that you've done in helping to coordinate this. And maybe you have some last instructions for us, I don't know, but I thank you for what you've done in putting this together and helping us to recruit everybody.
Yeah, I just had a quick last minute poll for anybody that's still on the call here. So if you just want to kind of take a look at that, answer that question, feel free to do that. As people are answering as well, I just wanted to have put a last minute thing out there too. Us in the career and professional development, we are always here year round to meet with students and alumni as well. So even when you graduate, you're more than welcome to come back and meet with a career coach. But yeah, wherever you are at, whether that's writing a resume, interviewing for an internship, looking for a job, we are here to help. So reach out, and you can always schedule an appointment directly through Handshake, and all students and alumni will always have access to that as well. But yeah, thank you. Yeah, I don't know if Donna has any last minute things, but just wanted to say thank you. This was really, really helpful for me too when I'm kind of thinking about advising and coaching just students interested in helping professions in general, because I think there's so many of these careers that are not interchangeable, but they're so connected in so many different ways. So, you know, whether you're interested in mental health or inclusive healthcare, I think that like knowing that there's so many transferable skills and so many things that you can do in like a variety of those things at the same time is really cool. So thank you.
Yeah, I would just like to also say thank you for sharing your time and your experience with our students and our staff. I mean, I gained a lot of information. I'm kind of like the front end of the office, so I get a lot. I stepped away a couple of times to answer calls from students asking questions, and you know, just having a connection with the student's perspective from education to job is just really, really helpful for me because I am always in that learning capacity as well. I mean, so I really did enjoy all the conversations and the topics that you were able to share your perspective with us, and just it's a great way to end a week. I have to say that. So thank you. Thank you, Christina, Fadouk, and Professor Young, and Brittany for all joining in and working together on this. And to all our students who attended, I think it was, yeah, great way to spend a Friday.
I would just like to say one last thing. For myself, and I'm sure my cohort, I did see some people in my cohort join today. It's definitely been a great pleasure and an honor to have you all answer these particular questions and engage with us. It definitely set the tone and raised the bar for myself for a little bit because I know what I need to go after. And I definitely have taken away some key points, and I hope others in my cohort have as well. So thank you so much for your time.
I'll stick around in case anybody has any last minute questions, but feel free to head out, and thank you for joining, everyone.
Thank you for having us.
Thank you so much for the
Thank
invite
you.
and the opportunity to share anything I could.